Hi, I'm Dr. Bill Cushing, and today I'd like to discuss Medicaid Basics. Medicaid. Now, Medicaid is a federal-state partnership that was originally designed to pay for health care for people with incomes below the poverty level. Some call it an assistance program rather than an insurance program. I am of the opinion that if there are no premiums, deductibles, coinsurance, then it is not an insurance program. Now, Obamacare has increased the number of people eligible for Medicaid. This has significantly increased the number of people being assisted by Medicaid. The federal government contributes money to each state as its share of Medicaid. The amount of the Fed's payment to each state is based upon the state's average per capita income in relationship to the national average. Medicaid is a major component of each state's budget. Medicaid's share of all states' budget in 2015, and including the Fed's share, was 28.2%. That's right, 28.2% of the state's budget. Over a quarter of a state's budget is attributable to Medicaid. It is a big number. Physicians have to choose to participate in Medicaid and must agree to accept Medicaid as full payment for services covered under Medicaid. Federal guidelines delineate the services Medicaid is required to cover, but each state may decide to expand these services. Some of the programs you will encounter in practice are EPSDT, the Early and Periodic Screening, Diagnosis, and Treatment Program. Now, EPSDT is a prevention and treatment program for children enrolled in Medicaid under the age of 21. States must pay for all services in an EPSDT exam. CHIP, that's the Children's Health Insurance Program. CHIP covers children from low-income families that cannot qualify for Medicaid. It covers children up to the age of 19. TWWIIA, the Ticket to Work and Work Incentives Improvement Act of 1999. This act allows disabled individuals to purchase Medicaid coverage in order for them to maintain employment. The objective is to negate the need to choose between employment and qualifying for health care coverage. Medicaid. Now, TANF, or the Temporary Assistance for Needy Families. This program assists individuals with living expenses, not medical coverage, and is administered by Medicaid. Medically needy program or category. This designation assists those earning enough to cover basic living expenses, but who cannot afford significant medical costs. Some of the assistance to this group has coinsurance and deductibles. An individual's eligibility for Medicaid can change on a monthly basis, so it is necessary that each Medicaid patient eligibility be verified at the time an appointment is made, and then again at the time of the visit. Many states are now converting Medicaid to managed care. The managed care gatekeeper concept places a greater burden on a Medicaid PCP. So if you're a primary care doc, be particularly careful in picking a Medicaid managed care plan to participate in. Well, I hope this helps. Have a good day.